I'm Joe Chile. You can listen to me mornings on the Big Weck. Joining us today in the Big Weck's Buffalo on the Rise is Cathy Aquino. Now, Cathy, I'm going to have to look here for your title because it's Vice President of Sales, Medicare, Consumer and Small Business Markets at Independent Health. Now, I got that all right.
Got it all right, Joe.
All right, that's
Thank
perfect. You. Hey, welcome to the show.
Why, thank you for having me. I appreciate it.
Glad to have you here. Independent Health is a name that people are very familiar with in Western New York. Can you share some of the history of the company and what you actually do with the company?
Sure. Independent Health started back in 1980. We are based in Williamsville, New York. And since 1980, we have been serving consumers here in the 8 counties of Western New York. As beginning days, HMO or Health Maintenance Organization, we've evolved into much more than that. But as the only local health plan here in Western New York, our employees live and work here in the 8 counties of Western New York. So as the local health plan, we're able to support the needs of people who get their insurance through employer groups individually, either through Medicare, the state programs, and small group and large group businesses. And one other piece is self-funded. So that's another entity underneath our umbrella of offerings. But as part of the local health plan, and we're able to offer insurance to individuals here in Western New York, my role as a vice president, I have the smart, amazing red shirts that help to enroll people in our Medicare individual plans, Medicare Advantage, our state programs, which would be our Medicaid, Child Health Plus, Family Health Plus, and our small group businesses. So those under 50 employees, our red shirts are able to enroll them in our small group products. So my smart team helps people pick out health plans to make sure they're in the right one.
So I want to know, now you've got this great jacket on that says Independent Health, 40 years the RedShirt Treatment.
Yep.
Now, when you walk into someplace, do people automatically say, "Are you one of the red shirts?"
Absolutely.
They do?
And you know, it's funny because I was a part of when this evolved into this RedShirt Treatment, and we used to do presentations out in the community in the beginning years of our Medicare Advantage plans, and we used to hold them out here in Western New York at the restaurants and what have you, and we'd get 200 people in a room, Joe, and we'd do a formal presentation, and then afterwards people would be like, "I need to talk to you, I need to talk to you." Well, we all had red shirts. So a gentleman stopped us and said, "Hey, I need to talk to a red shirt." Thus, the name was evolved, and we have a lot of this in our wardrobe. But even when I go into the grocery store or the bank, you know, people will be like, "Hey, I have a question." But that red shirt really drives home our commitment to exceptional customer service, one-on-one attention. And again, the RedShirt Treatment has been evolving and still continues to support our Western New York, members here with health insurance.
And now you don't have anyone on staff, any associate that says, "But I don't look good in red."
Yeah, I'm sure there's many of them out there.
They're not going to admit to it.
No, not at all.
I understand that Independent Health has had some prestigious awards in its time. Tell us about some of those.
Sure. The second year in a row, we've been recognized by the Center of Medicare and Medicaid Services, CMS, which is the who has oversight of the Medicare Advantage plans across the country. So they have recognized us with a 5-star status, which is the highest you can get. And basically, as I can't encourage Medicare beneficiaries enough to ask the health plan they're enrolled in, what's your star rating? Because Independent Health, with the 5-star status for our HMO, our PPO, and our prescription drug plans, so those are the 3 plans we offer, Joe, out in the community, we are the only local health plan that received that 5-star status for 2024. And really, it's time, it's available now for individuals enrolling in Medicare Advantage plans to assess the quality, the value, and the performance of the health plan. And it's a pretty important report card that we are acknowledged by the Centers of Medicare and Medicaid.
Now, do people are there people that have like 3-star plans and 2-star plans? So it's a gradual thing.
Yeah.
To get 5 stars is pretty important.
Yeah, and important is to maintain because it's a delivery by the health plan on managing their customers' chronic medical conditions, their prescriptions, their member experience. So important is when you call your health plan, you want to make sure they're going to be there to pick up the phone timely. And when they do pick up the phone within the required time frame, which is part of the report card, that they're giving you accurate answers. So that's what we deliver on because that's super important to Independent Health. And we are acknowledged by Medicare then that we're doing a really great job taking care of our customers.
When you start talking about Medicare enrollment and an enrollment period, because all of us, whether we are currently enrolled or not, get flooded
Yeah.
with snail mail, with text, with email, with regard to this. So what are we talking about when we talk about the enrollment period?
Sure, it's called the annual enrollment period, and it started October 15th and it runs through December 7th. And that's that one time a year that Medicare beneficiaries can choose the plan that they choose to be enrolled in for next year, 2024. And because we're a 5-star rated plan, Independent Health, I think I mentioned that to you, we are able to enroll people all year round. So after this annual enrollment period ends December 7th, and I encourage people to get in and get their RedShirt benefit reviews. Don't wait to the last day, because we do have people who do that. But all that mail that you're getting flooded into your mailbox is to tell you how important it is. And for Independent Health members, if they're happy with the plan they're enrolled in, Joe, they don't have to do anything at all. We'll automatically enroll them for next year.
All right, but you give people the opportunity to review during this period of time.
Correct.
So in the event that for some reason or another, a doctor's not in a plan, or they have a new doctor or new prescriptions or something like that, they have the opportunity to sit down with you and learn about.
And actually that's what we provide with that one-on-one attention, Joe. We call it the RedShirt benefit review, and we encourage people to bring a list of those prescriptions. You might have gotten something new, this year, and you're going to continue next year with that. List of their providers, their doctors. Not all health plans cover all the doctors and all the hospitals. We cover just about all of them. So again, we want to check that off the list, make sure that everything's covered, and then put you in the right plan that's going to give you the best coverage.
All right. Website or phone number that people should...
our call center is open 7 days a week, 8 a.m. to 8 p.m. It's 635-4900. And a RedShirt's standing by and make sure you have your prescriptions and all that stuff I said available, so we can make sure we're getting you in the right plan.
And a website?
www.independenthealth.com. Simple as that.
Very good. Thank you very much. I appreciate it, Cathy.
Awesome. Thank you.
All right. For more information and answers to your questions, contact Independent Health by calling 716-635-4900 or go to independenthealth.com/Medicare 2024. Sponsorship and promotional consideration for the preceding segment was brought to you by the following.